To start out on the client, I am going to just do one shot on her bottom lip. That way she can kind of feel the pressure and know what to expect when I'm doing her lips. And now what I'm doing is going in and just using my fingers to hold her lip in place. And I am rubbing out any of the excess filler that comes out. With the pen, you always have a little bit of product loss, which is completely normal. I am just getting her warmed up to the pen, so I'm not doing anything too crazy yet, but you can also leave the pen in place for a longer period of time after you inject the filler. And if you do that, it kind of helps the product go in better and you lose less product going in. So that's one trick I've learned to kind of help as well. And then also you can see here, I'm not going directly in her waterline, but instead I am going on her lips where the dry meets the wet part. You want to stay in that area. You don't want to get too close inside the lips. And you also want to be really careful not to block the filler from going in on the other side. You guys can already see here it's starting to get plumper. So what I am doing is just going ahead and continuing on her bottom lip to get that as plump as we can get it for now, and then we'll move to her top. A few things to keep in mind as you're doing the client's bottom lip. You can see here that in that technique, I am kind of shooting from the side. So I'm holding the lip up and then shooting inwards right there. And if you make a pocket like that for the lips, it's easier to shoot the filler in it. And then I am just massaging it out as I go. So it really helps to massage the lips as you're doing it. I feel like that kind of prevents some of those bumps and lumps, and then also wiping off any blood that's coming out. You want the surface to be as dry as possible. If there's blood on it or filler or whatever is on your pen ampule, it makes it very slippery, which is harder to do the lip. So just going as slowly as you need to get the desired result. And it's okay if it takes you a while to do everything. This definitely isn't something that's quick. So now I am moving on to the top lip. I like to use these little gauze rolls. I will go ahead and attach it in the link to the video. It really helps to form the lip and be able to roll the lip forward to get the top lip, especially if it's smaller. You can see here the client's eyes are watering a bit because it does sting a little bit more on the top, but it's just a natural reaction for a lot of people. And it's just like if you get hit in the nose, so it doesn't necessarily hurt her, it's just giving a little bit of that sting. And so you are able to go ahead and renumb, which is what I did here in a minute, just so she's comfortable. So this is after we've renumbed, and you can see I am just holding the little gauze and putting it in and out as needed. If your client has enough room in their mouth to hold it in there, that's perfect. You can just keep it in there for them. If not, you can just move it in and out. You can see I'm also shooting above her lips for this, like where the waterline is. That's what gives you that flat look, where it enhances what she already has without making it puff out too far. It just brings up where the red is in her lips. So you can see already we're already getting a little bit of the filler there, and it's looking good. So I'm just going to continue doing the top row or the top lip, and you guys will see the end result soon. And then next you'll see the before and after photos. She does have minor swelling, which is completely normal, but we did get a really pretty before and after, and it will take about 7 days for the filler to fully settle and give the final result.